Hello, everybody. This is Gary. Today is February 4th, 2022. It's 5:33 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today, I went to see my primary care physician about the physical pain I'm having in my joints, my muscles, and in my nerves. They still did not make a definitive diagnosis of any kind. But it's possible that what I'm suffering from is fibromyalgia. My primary care doctor has kept me on Neurontin to deal with the physical pain, and she also added the depressant cymbalta, which is used for nerve pain for several different types of conditions. So I will be taking cymbalta, and we will be slowly increasing the dose over the next few weeks. It may take up to 6 weeks before I notice any real pain relief from the cymbalta, and a few more weeks before I notice pain relief from the Neurontin. But at least I feel like I'm making progress towards getting some relief for my pain. Of course, opiate drugs are not an option. Those don't solve anything in the long term and only cause addiction. I've taken opiate drugs before for pain after surgery. I had bladder surgery, I had prostate surgery. And the only thing the opioids do is make me confused. And each time that I took them after surgery, I ended up in the psychiatric emergency room. So opioid drugs are not a good choice for physical pain when it comes to fibromyalgia or any other type of nerve pain. It's certainly not a long-term solution at all. And I have to be patient to give my medications a chance to work. In the meantime, I'm still doing physical therapy, working on my lower body. And the next time I meet with my physical therapist, we'll concentrate on working on my upper body as well as my lower body. Um, and so physical therapy is definitely going to still be a part of my pain management, and regular exercise is also recommended for fibromyalgia, if that is in fact what I have. It's too early to make a diagnosis of fibromyalgia because you have to have symptoms of pain in specific areas for up to 3 months to make a diagnosis of fibromyalgia. The other thing, I had several x-rays done both in the emergency room and outside the emergency room. I have a lot of bone spurs in my knee joints, my spine, my lower spine, my upper spine, as well as arthritis. So that's certainly causing a lot of the physical pain I'm having. And again, cymbalta helps with that as well as does the Neurontin. So I will be taking both those medications. I'm also taking arthritis strength Tylenol, which means 650 milligrams, 2 tablets, 3 times a day, no more than that in a 24-hour period because it could cause liver damage. There are potential side effects from cymbalta. I'm not going to get into those right now. I'm not a doctor. But as far as my psychiatric symptoms are concerned, they're pretty much under control right now. My anxiety levels are not too high. My depression's not too severe today. My paranoia is not that bad. And my hallucinations are very minimal. They're always there, my auditory hallucinations, and they're pretty much easy to ignore today. They usually have paranoid content telling me that people are spying on me, following me, and that kind of thing. So not much to report as far as my psychiatric symptoms. I just feel a lot better mentally knowing that I'm finally able to tackle some of these issues with my physical pain. And as far as my skeletal problems, the bone spurs and the arthritis, I was referred to I forget what the name of the specialist is. Whoever deals with bones and bone diseases and arthritis, I forget the name of the specialist, but I was referred to a specialist for the bone spurs in my spine and my joints as well as the arthritis. orthopedics. I think that's the way I'm looking for it. And I will be examined by an orthopedic specialist to see if we can do anything about the bone spurs. The bone spurs are like an extra growth of bone that aren't supposed to be there, that grow in the joints, like my spine and my knees, upper spine, lower spine, that kind of thing. Of course, arthritis is different from that, and I seem to have both together, so those definitely are causing some of my physical pain. So I finally feel like I'm making progress towards what the fuck is going on with all the pain that I'm having. It's nothing fatal. It's not cancer or anything like that, thank God. So I'm doing pretty well today, just knowing that I made some progress today in my pain control. And a good side effect of the cymbalta is the cymbalta is an antidepressant, and it may help relieve some of my anxiety and depression as a side benefit of taking it. Because other than the cymbalta, I'm not on any of the antidepressants. I haven't been on an antidepressant in a very, very long time. I'm not sure why. I'm on Seroquel, but that's not really an antidepressant. It's more a mood stabilizer and an antipsychotic, because I do have schizoaffective disorder, which is on the schizophrenia spectrum. So that might be a side benefit, but nothing else to report right now. Like, share, comment, subscribe. If you want me to do a video on a specific topic, let me know in the comment section.